In our medical news today, getting a smartphone at a younger age could put children at higher risk of health complications. A new study published in the journal Pediatrics looked at more than 10,000 12-year-olds. Kids who get phones at young ages are more likely to face obesity, depression, and sleep problems, they found. And the FDA plans to tighten approval standards for COVID vaccines. In a memo, Dr. Vinay Prasad said 10 children's deaths were linked to the vaccine. He did not provide data to support that.
There is no definitive evidence that COVID vaccines cause death in children. No definitive evidence that COVID vaccines are dangerous for children.
Okay.
What we do know is COVID infection is dangerous.
Myocarditis, or inflammation of the heart, has been linked to the COVID vaccine, but studies have largely confirmed the risk of the condition is significantly higher after a COVID infection. It is a time of year filled with family and traditions, but for some who've lost a loved one, the holidays can bring sadness. Mandy Gaither has ways to cope with grief during a time that's supposed to be filled with happiness.
It's the season of joy and happiness, but if you're grieving a loss, the holidays may also bring sorrow and pain.
While the holidays can be a wonderful time, it can also bring up memories of lost family members, which we know can then exacerbate potential feelings of sadness, feelings of hurt, disappointment, and potential anger.
Clinical psychologist Adam Borland with Cleveland Clinic says it's important to recognize that this time of year can be difficult, whether it's your first holiday without a loved one or you've grieved through multiple ones. It's okay to feel sad this time of year.
Communicate with your support system. If you're feeling this way, it's likely that another family member is also feeling this way.
Experts say understanding that feelings of sadness may be heightened this time of year can be reassuring. So express those feelings to someone you trust and be flexible with holiday traditions. Family members may need to manage expectations regarding those rituals. You can also start new ones, honoring the lost loved one.
Focus on the happy memories that you had with this individual. Maybe look at some photographs, maybe exchange stories.
Focus on coping skills that have helped you in the past and recognize that you can hold more than one feeling at a time. Finally, intentionally care for yourself. Experts say it can be helpful to make a checklist of healthy habits.
It's okay to feel this way. It's okay to miss that person. And if it gets to a point where it's really problematic, you can speak with a trained mental health professional.
The National Council on Aging says for those grieving, it's also important to plan ahead and set boundaries. If you can't handle an event or get together over the holidays, it is okay to choose not to participate.